Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Steven Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. Today's episode covers a major shakeup at the nation's top public health agency, the abrupt firing of CDC Director Susan Monarez after less than 1 month on the job, and the mass resignations of several other senior leaders. This story isn't just about one person losing her position, it's about the politicization of science, the dismantling of institutions, and what it means for all of us who depend on evidence-based public health guidance. Okay, so what happened here? Susan Monarez was confirmed as the CDC's 21st director in July, making her the first to go through Senate confirmation under a 2023 law. Less than a month later, she was forced out. The White House claims she wasn't, quote, aligned with President Trump's agenda, but her lawyers say she was fired because she refused to rubber stamp reckless directives and stood up for science. At the same time, at least 4 top CDC leaders resigned, citing budget cuts, reorganizations, and being asked to support policies that don't reflect scientific reality. This isn't just about personnel at the CDC. The CDC has long been one of the most respected health agencies in the world, guiding responses to infectious disease outbreaks, chronic disease prevention, and global health. Now, in just a few weeks, we've seen its leadership hollowed out. Experts like Dr. Dimitri Daskalakis warned in their resignation letters that putting people of dubious intent and dubious scientific rigor in charge of vaccine policy would lead to preventable death and disability. The departure of Monarez and other leaders signals a deeper issue: the systemic dismantling of evidence-based institutions. When politics override science, patients and communities are put at risk. Michael Osterholm, one of the country's top infectious disease experts, called the resignations a, quote, serious loss for America, making our nation less safe and less prepared for future health emergencies. For patients, this translates into mixed messages about vaccines, fewer trusted experts leading the charge during outbreaks, and public health weakened at the very moment we need it most. Monarez's tenure was very short, but her stance matters. She tried to protect the agency's integrity and was pushed out for it. The question is, what comes next? Will the CDC remain a trusted, science-based public health agency, or will it continue to be politicized to the point where Americans no longer know who to trust? These decisions don't just affect bureaucrats in Washington. They affect whether your doctor has the best guidance during a measles outbreak, whether your child's vaccines are based on science or politics, and whether our country is prepared for the next pandemic. We'll take a deeper dive into the fall vaccine schedule in a future episode of The Health Advocates. But for today, that's all for this week. The firing of CDC Director Susan Monarez is a turning point, not only for the agency, but for the future of science and our democracy. As always, you can find more resources and patient-focused health policy updates at GHLF.org. Thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you found this episode helpful, please leave us a rating or review and share it with someone who cares about healthcare policy. And be sure to follow us wherever you get your podcasts. You can find all of GHLF's podcasts at ghlf.org/listen. I'm Steven Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.